I always like to stand to the on the left side because I'm left of center, but today I find I'm on both sides. Anyway, I'm really a central procedure. So model science in medical writing, and the reason I've been asked to talk about this is I'm associated with some medical journals, the National Medical Journal of India, Indian Journal of Cancer, of which I'm the editor, the Indian Journal of Medical Ethics, and with Current Science. And I must tell you that all of them are free full text online journals. Neither the author pays nor the reader pays. In the sense, it's free. The government is paying for these journals. I do encourage you, and this is a conflict of interest, I do encourage you to submit to these journals as and when possible. Okay, so all of us know why we publish, but why is it that people cheat when they want to publish? And the reasons for this are pretty easy, really. First of all, in the West, you always had this publish or perish attitude, and now it is increasingly coming into India, thanks in part to the Medical Council of India. I'll be coming to the MCI and its shenanigans later on in my talk, but that's one of the reasons. You have a publish or perish attitude, which of course is linked to your promotions. You don't go from associate professor to professor unless you have 2 papers and 1 letter and 1 case report or whatever. So you're forced to do that. In addition to that, they come out with these funny rules about being first author or second author, and so then you push yourself up on the author list because there's no point writing the paper which has solved the problem of cancer if you're the 3rd author on that. You don't get any marks for it. Fame. Everybody wants to solve the problem of cancer or discover why hypertension has taken place. You want fame as the person who has discovered a secret of nature. So, if you can't find out, you will then try to create fame for yourself and land up cheating. Monetary rewards. Not so much in India at the moment, but in China, for instance, the government actually pays you to publish your research. And so people have started cheating out there in order to make money. And finally, the messiah complex, which is related to fame. The messiah complex is, you know you're right. Your evidence doesn't fit. There's something wrong with the evidence then. So let's change the evidence to show that what you always knew, you are right. So people do that. And guys like McBride and Andrew Wakefield are guys who fudge the data in order to support what they have always believed. I'll come to them again later. But why is fraud wrong? All of us instinctively know that fraud is wrong, but why is it wrong? It's wrong because it damages, at some stage you are going to get caught, okay? So at that stage, you are damaging yourself, you are damaging your reputation, you are damaging the reputation of your institution, you are damaging the reputation of your profession, your science. That's what you are doing. That's what I say when I say damages the field. You are putting patients at risk. All of us are doing medical research, and when you are doing fraud in medical research, you are putting patients' lives at risk. And that is absolutely not on, because it beats the primary thing of primum non nocere. You're not supposed to be doing that at all. So fraud in medicine is called, or model science is called research misconduct. That's the technical term. And it is what I call a form of corruption in medical research. I don't know if my next slide is, okay, no, I'll be coming to that later. Shamiran Nandi and Keshav Desi Raju and Sanjay Pai have recently written a book on corruption in healthcare in India, and they asked me to write a chapter on on research misconduct. They wanted me to write on corruption in research. So I call it research misconduct because that's the technical term. Now, according to Stephen Locke, ex-editor of the BMJ, a modern history of fraud in medicine begins in 1974 when William Summerlin was exposed for his misdeeds at the Memorial Sloan Kettering Institute in New York. What did Summerlin do? Summerlin was a dermatologist who was in dermatology research, and he solved the problem of immunological tolerance. He showed that he was experimenting with mice, and he showed that skin from white mice could be transferred surgically onto black mice without any rejection. Just for one thing, the black skin that had transplanted, one of the lab technicians got a little suspicious and rubbed alcohol on it, and it turned white. He had just used marking pen, felt pen to transfer the white skin and color it black. Didn't work for more than a day or so, right? And that was that. Someone lost his job overnight. The director of Memorial Sloan Kettering, Robert Good, who used to think was Robert God, also lost his job overnight because he was overseeing this research. And that was the end of immunological tolerance, and white skin and black skin mice was. So that's the modern history of fraud in medicine. Now the ethical issues that Shrikala and I think you guys expect me to talk on today are on plagiarism. These are the terms which everybody knows, right? plagiarism, falsification, fabrication, not complying with legal issues, not retracting a wrong paper, and authorship issues. So I'll deal with some of these in some time. Then I'll go on to other parts also which you might not have thought that I would talk about. What's plagiarism? I think everybody out here knows it. And I'm sure everybody out here knows somebody who's done plagiarism. Maybe many people who have done plagiarism. It's a form of piracy, and this is a definition. And I have to say it's a definition because if I don't tell you it's a definition from our dictionary, I'll be guilty of plagiarism myself. Anyway, it's a form of piracy which involves use of others' ideas or words without permission or acknowledgement. That's the definition. It's increasing in medical journals and scientific journals, obviously because of Google. You now see, and people don't even realize it's plagiarism very often. You see high school students doing their projects all the time. They just open up Wikipedia, cut and paste 10,000 words, put it into PowerPoint and they think, my project done. And I'm at great pains trying to explain to all kinds of people, that's not research. Research is sitting and reading multiple things, putting it in your own words, and often I find I'm fighting a losing battle. But you have to keep on telling that so that some people at least understand and get onto the correct page, so to say. The daft guys, and I'm telling you a secret out here, okay, as an editor. The daft guys who use Wiki or Google to submit papers to you don't realize that even the editor has access to Wiki or Google. And so the moment I see a paragraph which looks in totally different English compared to the rest of it, all I do is I copy paste that and put it into Google and out comes the answer. And so then I write to the author that, excellent article. However, this entire 400 word looks very similar to this, and can you explain it? I keep doing this all the time. Not once have I got a reply back from the author. Not once have they resubmitted the paper because I'm not telling, boss, what do you have to say? There's nothing to say. Self-plagiarism and repetitive plagiarism are also considered plagiarism. What is self-plagiarism? When you write an article on, let us say, alcoholic liver disease, or 3,000 word article. A couple of months later, some other journal approaches you and asks you to write an article on alcoholic liver disease. And since not much has happened in the last 2 months, in current advances, you write the same thing all over again. You transfer a the into an and o into a the and a the into a, make a little bit of changes here and there, and submit the same thing all over again without stating that you written an article before 2 months. That's self-plagiarism, and that's not on. And why is it not on? Because you're just apparently adding to the literature without actually having done so. So that's not on. Okay, Indian Journal of Cancer, my experience. On November 8th, 2017, I became chief editor of the Indian Journal of Cancer. The first 3 papers that I received as editor were wholly plagiarized. I was very depressing. I said, am I going to be doing this all the time? Fortunately, it stopped after that, but pure coincidence that the first 3 papers I get as editor are plagiarized totally. Then as it turned out, the next 2 or 3 papers I rejected as not good. And I remember calling up the secretary of the society. I said, boss, I rejected 6 papers in a row. 6 months down, if this trend continues, 6 months down the line, you'll only have 2 covers. No papers in between, because I'm either rejecting or I'm catching up plagiarism. But after that, it improved. What's fabrication and falsification? Related, obviously, after all, both begin with F. But anyway, fabrication is cooking up data, and falsification is manipulating data. What's the difference? Subtle difference, but you need to know. Fabrication is when you're sitting in the library and you write a paper on 100 patients that you have seen and on whom you have done omentopexy or whatever. When you're not seeing any patient, you've been sitting in the library. That is fabrication. Falsification is when you're actually a surgeon and a good surgeon, and you have done surgery of 96 cases of omentopexy and discovered that there is a paper in the literature of 98 cases, and you say 100 cases banayega. How about the world's largest series then? So you gone from 96 to 100 for no reason at all. That's fraud. Even if you gone from 10,000 to 10,001 for convenience, it is falsification and fraud. It's not on. Stick to what you've done. Examples of fabrication and falsification. Well, the patchwork mice by William Sutherland, which I told you in 1974. The other examples you also know. Bezwoda was this chappie who did some astounding research in the mid-1990s in South Africa. He showed that bone marrow transplant could be a cure for metastatic breast cancer. And he showed fantastic results. published in any JM and some of the journals, and then somebody started getting, must we like to see why is it not working in our setup, why is it working in yours? So we like to see our raw data. He just couldn't produce the raw data until finally the investigators went down to South Africa and discovered that he was sitting in a shed and writing these papers. No patients at all. So that was the end of Besboda and bone marrow transplants for breast cancer. Wang Wusuk and stem cells in 2006, I'm sure all of you know. The guy who said that Koreans are better at stem cell research because they eat chopsticks and can pick up cells better, was actually just creating his. You don't remember this? Oh, great stuff. You show work on embryonic stem cells. Within weeks, they say this guy's a potential Nobel Prize winner, and he talks about chopsticks and how research is easier when you eat with chopsticks. And then it's chop to the research. Anyway, Serbo was this Norwegian, Danish, I don't remember, either Norwegian or Danish oral cancer researcher who published only in New England Journal of Medicine and JCO. And at some stage, someone got a little suspicious because they discovered that, before that, what happened was he published this thing on oral cancer, and the reason they got suspicious about him was somebody said that this cancer database has not even been opened by the government, and he's published on 800 patients already. That can be only one thing, it's fraud. So they investigated it further, and then they found that papers across years of different populations had same graphs and same illustrations. And the whole thing fell apart. He was just concocting data. He was doing it very, very well. Yeah, but you see, not all that well, because in one of his studies they discovered of 250 patients in the database, 208 of them had the same birthday. So, but these are things they should have picked up earlier. They should have waited for any JM publication and other such things. Scott Rubin was a pain consultant in the US he did great research on how NSAIDs and COX-2 inhibitors were useful for pain and for control of pain for patients, and until he got caught in 2010, again fraud, making up patients. The problem with Scott Rubin's data is that he'd been doing it for years. He's supposed to be the only single investigator who's gotten away for 10 or 15 or 20 years, and the thing is, based on his studies for 10 or 15 or 20 years, people have been doing other studies, and so now it's gone out into the community, and it's very difficult to go back to the original thing and block all studies based on his studies. So that damage has been done, and some of the stuff that you're going to believe today in the textbooks is going to be because of this trickle-down effect of Scott Rubin's fraud. Data manipulation and data tampering or photo manipulation is you're running a gel, you make it slightly darker so it looks positive and not positive. Also, not all. Misconduct data, just a little bit. There's this guy in Europe, I can't recall his name right now. He's done a lot of work on research misconduct, and he showed that of 788 papers retracted on PubMed from 2000 to 2010, the most common reason for India was being broken apart in pause according to country and so on and so forth, that for India it is fraud. The reason I tell you that is you don't retract a paper only for fraud. You might make a mistake and then you might have to retract the paper. But the most common reason for India is fraud. Also data for India, this is not from that study, from another study I found. Prior to 1990, papers retracted in India for fraud, papers retracted in India, 0. For 1990 to 2000, 7 papers. 2001 to 2010, 69 papers. Now obviously this is a real increase as well as an apparent increase. It's not just that fraud is on the increase, it is just that editors are more careful now, they are looking for it, they are investigating. You didn't have the internet in 1990, you didn't have Medline all over the place. Now by 2001, 2010, you have Medline all over, it's easily accessible, it's easier to figure out if somebody has done fraud. Previously you couldn't catch. So it's a real as well as apparent increase in fraud. Doubtless from 2010 to 2018, what do you think? Will it have increased or decreased? I think it will be about static because people are more careful also. They know they're going to get caught. So I suspect some of them, the borderline wallahs, shall I do fraud or not, will probably back off. The bold ones will go ahead and get caught. Okay, but on the other hand, there are some ways where misconduct will increase, and that is because of clinical trials which have come to India after 2005. And I know I'm contradicting myself when I say that I think it's going to be borderline, but on the other hand, it might increase because of this new thing which has come in a year ago about you need to publish papers to get promotions. But let's wait and watch what happens. And of course, Google and Wikipedia are around, but I told you that even we as editors have access to Google and Wikipedia to see whether you guys are dealing with fraud. I did mention this book yesterday as well as today. Once again, I say I'm not paid any royalty for it, so there's no conflict of interest. But a lot of what I wrote on recent misconduct is in the chapter in this book, and I will be not talking to you about it because there are other things for me to talk on. We're talking retraction between 2001 and 2010. The 69 papers. One of them is this paper by Pai et al., and that's me. And it's not for fraud. It's for an error. In 2003, I published what I thought was absolutely fantastic paper, and in 2005 April, I got some additional clinical information on that patient, which I realized negated the diagnosis of the previous one. That clinical information was not available either to the surgeon or the gastroenterologist or the other gastroenterologist or to me at the time I made the diagnosis. The moment I learned the correct diagnosis, I knew I would be sending out a wrong message. What I was doing was, Salami carcinoid is a tumor which has only been described in the foregut. I saw a case in the rectum, so it was a hindgut tumor. So what I was trying to show was, there's something peculiar with embryology where you can get a foregut tumor in the hindgut. You know, it makes embryology stand upside down. So I thought it was a damn good paper, but when I got additional information that the patient had a previous tumor elsewhere and this was a metastatic deposit, it changed everything. So I wrote to the editor and said, sorry, I goofed up, please retract the paper, which he of course did immediately. And that is it stands. But if I don't retract it, it's going to go down into literature as such and such tumors are almost always seen in the foregut. However, in peculiar embryology, it may be seen in the hindgut. That would be wrong. So this is not for fraud, it's only for stupidity. Okay. Authorship. Another this term which V.K. Kapoor uses, polyauthoritis giftosa. And that's what so many people do, you know. I'll write a paper, I'll put your name, you write a paper, put my name, so that way we have two papers rather than one paper. And this is it's rampant all over, very much so in India. Don't do it, it's not wrong, it's not science, it's not the truth. And an extreme example of this was a colleague of mine, a husband was a doctor, her father was a doctor. She wrote 2 papers a year, put their names on it. Husband wrote 2 papers a year, put wife's and father's name on it. Father-in-law wrote 2 papers a year, put son's and daughter's name on it. So all of them had 6 papers a year, whereas they're actually doing 2 papers a year. That's an extreme case. It also happens within departments, okay, between friends. That's absolutely wrong. The other end of the extreme is excluding deserving people as authors. You have somebody who's actually contributed for it? No. That was the... excluding deserving people as authors is also not on, whether they are junior, senior or whatever. Only somebody who has worked on that paper gets to be an author on that paper because it's a scientific record. The others should be left out. Extremely important, the head of the department has no business to be a co-author if he or she has done nothing on the paper. I know I'm standing in a medical college and I had one of the principals in this medical college, but where I was trained, Tata Memorial Hospital in Bombay, the HOD was never a co-author on the paper unless she. It's always a she, right, out there. In pathology, there are only women, we are the outliers. So, even now in my department, there are 6 girls and me. I'm not complaining, I'm just telling you. So HOD doesn't become author just because he's around. You know, it's your duty to provide assistance, guidance. You may get acknowledgements, or in my case, I don't even want acknowledgements because I don't need them because it's my duty. I'm just doing what I'm supposed to do. But a lot of medical colleges, it's expected and it has been a tradition, and so it continues. You need somebody to buck that trend, you need somebody to question. Family. Oh, I kid you not, I just told you about family. Friends, you know about, they are trying to impress the girl or the boy or the girl. I don't know, anything is possible now. So, you try to impress someone and you try to put that person as a co-author in the hope that kuch ho jayega, kuch hota nahi hai. Only science goes for a toss. Ethical issues which people sometimes don't realize are ethical issues but which are extremely important. That is failure to publish. I just told you the problem with publishing too much, right? And having too many authors as co-authors as authors when they've done nothing. But failure to publish is a problem. Duplicate publication, Salami, Imalas, conflict of interest, and patient and IRB consent for reports of studies. Why is failure to publish an ethical issue? When I first read it, I said, why should it matter? But then if you reflect on it, it makes jolly good sense. You know, in every study that you do, you're involving patients, and those are human lives. So you do a study of 10,000 patients, let us say, receiving drug A for hypertension versus 10,000 people on drug B for hypertension to show that A is better than B. At the end of it, you find it's not. Or worse still, you find your drug A is worse than drug B. So you're obviously not going to publish it because it's your drug, your molecule that you discovered, the drug that you're trying to peddle to an unsuspecting public. You're not going to publish that, and then what happens? Along comes somebody 2 years down the line thinking, hey, let me do this great research, let me put 10,000 patients through 2 drugs A and B, and they do it, and then of it they find it doesn't work. They don't publish it for the same reason. And then 2 years down the line, along comes somebody else to do it. And that is the reason you are not supposed to register clinical trials, and you have to publish what you find, whether you like the results or not, so that future generations of patients are spared from unnecessary research. Or future generations of animals. It doesn't have to be just humans, right? So failure to publish is wrong for this reason. You are wasting resources by doing studies which are unnecessary because they've been done, and you are putting patients' lives at risk. And as I said, if you not publish, it's not out there. And that is why you have to publish such a thing. Duplicate publication, Salami, Imalas. I think I put a slide after this. Ravi gave me some valuable advice this morning. You should not arrange your slides, you should arrange your thoughts. Clearly my thoughts have gone for a toss. Let me check. Yes, I do have that slide. So negative results are rarely published here. Commercial or political interest dictate terms. And commercial interest is obviously when I make the molecule or when I own the drug and I want to sell it. And this is classically pharma research. Pharma research is always going to be this. I know I've got a drug which is better than the competitor's drug. Let me prove it. And if I can't prove it, I'm in trouble because I lose my job. Commercial, political interest, okay, related. Redundant or duplicate publication. I did tell you that if you have a paper which overlaps significantly with a previously published paper, you should not publish it again. Why? Because it's a waste of time for the editor, the referee and the reader. The editor, because believe me, as an editor, I have a problem locating referees. Most people are not interested in refereeing because you have to spend time and you get absolutely nothing in return. What people don't realize, however, when I send out an invite, and this is something for all of you guys, I haven't written an editorial in the latest Indian Journal of Cancer. We send out an invitation to people and ask them to be a referee for the journal. 9 out of 10, or maybe 7 or 8 out of 10 people don't even respond. They're not interested at all. And I actually called up some of them who are my friends and say, why don't you want to? He said, boss, mere paas time nahi hai. I mean, you have all the time in the world to sit and do research. You expect other people to find time to referee your paper and send back a comment on it. But you don't have time to do the other part of it. That's not fair. It's not science. No, it has to go the full circle. That's a circle of life. You referee and you have your papers refereed. So it's a waste of time. As it is, so there are such few referees. You're eating into their time by sending them a paper which has already been done. You're wasting the reader's time because after reading the whole article, he says, hey, I read this article 2 months ago in another format in another journal. It's a waste of time. Promotions may be misawarded, and a poor guy like me publishes only 1 paper a year, and like I told, this colleague of mine publishes 6 papers a year. So she's going to get a promotion. So what is there? Her husbands and fathers and father-in-laws and other people's research. The Babu who is sitting and looking at the CV, who is actually going to be pushing the papers in the academic office, only looks at numbers. I got only 1 paper in New England Journal of Medicine. She's got 4 papers in Kankaradi Journal of Medical Sciences. She gets promotion at all. That's not fair. So you have to look at the quality of the research. I am nothing against Kankaradi, okay? But they've got a fantastic Cochin bakery, I tell you that. And finally, it distorts the scientific data and evidence-based medicine. Somebody doing a meta-analysis is going to look and say that such and such an area has got 10,000 cases of such and such a disease, not realizing that the same guy has been publishing repeatedly from the same area. So you are going to distort science. So duplicate publication is not on, with very few exceptions, maybe 1 exception. And classically it is when when there is a WHO comes with some new guidelines, and they want to have that data disseminated across different areas, different specializations, different journals, and so it's published in multiple journals at one time. That's one. Or like an editorial which we wrote January of this issue. We wrote an anti-medical council of India editorial. There's no question to say about there, right? That is more dangerous than ICMR. I was still as my degree as I walked out of this place. Anyway. So, we wrote an anti-MCI editorial 2 years ago, wrote another anti-MCI editorial this time. And I'll show you the references later. So, we felt that the message we were putting through, across, we wrote it primarily for the Indian Journal of Medical Ethics because we had published a previous editorial there. But we felt that only, these philosophers and such other guys in Indian Journal of Medical Ethics, that's one population that you want to target. But you also want to target physicians, surgeons, gynecologists, psychiatrists, lots of people. So we put it out and said, is there anybody else who would like to carry this journal? There's only one rule, it has to be released in the January 1st issue of that journal. So that all journals run it at the same time. And some 6 or 7 other people joined hands with us and said, we like your editorial, we'd like to carry it because we think our readers, our population should have access to this thought that you guys have. Because obviously they were in agreement with us on this. Salami publications, you know what salami is? Anybody who's a meat eater, they will know salami is a chop of that meat, right? So one slab of lovely meat, which is slab meat, assuming you're a non-vegetarian. If you're a vegetarian, tough, but still lovely anyway. So you have this meat which is sliced into multiple thin pieces and then used for your sandwich or whatever. So salami publication is the same thing. You have this one lovely study that you've done, and you say that this guy is going to have one paper and he's competing with me for a promotion. So let me have 3 papers and make sure that I'm right. So you have these 200 papers and you break 200 patients in your study. You break it up into one study of 50 patients, one of 20 and one of 130. So you have 3 papers. And if you look at it, the discussion and everything is the same. But the Babu doesn't know that. He has seen 3 papers published by this guy. Or you might even want to make it 60-60. But anyway, that's not all. One exception to this is, you might pick up a disease like, let us say, multiple sclerosis, and you might have one paper which studies only the imaging characteristics of that, one which deals only with the epidemiology, and one which deals only with the patient characteristics and treatment of it. That is allowed because the discussion is entirely different. But all of these things, when you write to the editor, you have to tell him or her that you are publishing a paper, you are submitting this paper, and you are writing similar papers, and which authors, which journals you are submitted to. You might even have to put it in your references, work under progress or paper submitted and so on. So there has to be transparency in that. So Salami publication is a form of self-plagiarism for obvious reasons. It's the same thing that I say over and over and over again. Imalas is the other way around. Any anagram freak out, you will realize that Salami spelled backwards is Imalas. And what is Imalas? You have multiple small things you put together and make it. I don't know why I said financial, I should talk about conflict of interest. Conflict of interest of any kind is, okay, I'll put that. So financial conflict of interest is what most people think of when they think of conflict of interest. And that's because it's the one which is tangible, which can be measured. It's when you get research funds. I call it research funds because sometimes you get money from a drug company, and although they may not tell you that, it's understood that they will want findings which are favorable to their company. Obviously, they are not going to pay you to prove that their drug is not as good and the competitor's drug is good. No grant writer is going to give you money for such a thing. I'm a drug company, I give you a couple of lakh of rupees to do some study and tell you that I'd like to come to Buenos Aires to present the findings. What are you going to do? Say the paper is not good, the study is not good? No, you want to see Buenos Aires. So I want to get swayed by these things. There are small gifts, little gifts, big gifts, and here is Himalayas. They begin with small gifts and go on to big gifts. So I suggest you avoid these things. You get invited to pharma-sponsored conferences Pharma invites you to attend conferences. All of these are little things. Everybody likes to think that in the study that we did, we spoke to 25 doctors and asked for their prescription practices. We published it in the Journal of Medical Ethics about 10 years ago. It's one of my most quoted papers. Each of the physicians said, I'm absolutely honest, I'm not swayed by any of these pharma companies, but I know all of these other 24 fellows, all of them have been bought by the companies. Amazing thing, 25 guys who know each other, each is convinced that he or she is honest, all the others are dishonest. And it's a theory of something, it's called a theory of something invincibility. It's a term in psychology in 1992, I can't recall the word right now. It said, I'm invincible, everybody else is not. So these are all the hidden persuaders. All of advertising is hidden persuaders. Sometimes it's not even hidden, but you just go for it. Conflict of interest of the other kind, and here is a study of 56 trials which were funded by NSAID manufacturers, all were favorable to the company. What a coincidence, yeah? Huh? I mean, if you were to believe in statistics and probability, you would say that 50% of them should have been favorable, 50% of them should not have been. But they all were this thing, and let's spell a rat out there. There's another thing. Only 5% of cancer drugs had unfavorable outcome in studies sponsored by a company. I was thinking, how come even 5%? It should have been 0% ideally. Who would want to spend money and discover his company drug is not as good as the competitors? But when the same drugs were studied by non-profit agencies which had nothing to get out of it, it went up to 38%. And that again is more or less half and half. So this is why Richard Smith, ex-editor of the BMJ, he took off Stephen Law. After he quit the BMJ, he wrote an article in PLOS Medicine in April 2005. Medical journals are an extension of the marketing arm of pharmaceutical companies. And he says, having gotten out of medical journalism after 25 years, I realized that they were making a fool out of me all these years. He says, it's taken him a lifetime to figure out. I should have understood Richard Smith, but before that, informed consent is another problem. I'll straight jump to one thing. When people say, why do I have to take informed consent? Why do I have to take IRB consent for stating what is obvious and so on? If I were to present this slide to you 3 or 4 years ago, I would have gone into great explanations as to why it's ethical, why it's unethical and so on. Right now, I'll tell you only one thing. After 2013, the ICMR has made it mandatory for it to take permission from the patient or the IRB. And therefore, it is a law. So your opinion and my opinion is of no importance. You do it. Is that clear? You have no choice. But why the ICMR made it mandatory is because of these studies from India. Of course, the classic example of no informed consent is what happened in Nazi Germany when the so-called doctors experimented on patients for years before they were exposed. And of course, Tuskegee trials which took place between 1932 and 1972 in the United States when black patients, they're not African American and they were then called black. Black patients were followed up when they had syphilis just to see the natural course of the disease. Even though in 1932 there was nothing, there was no penicillin then. But by 1945 penicillin had been discovered. Still none of these patients were given penicillin just to study the natural course of the disease. But that's happened in America and Nazi Germany. But not too far from here in India, all this has happened. Ganpati Mudur's expose in the Telegraph and in the BMJ in 1997, he spoke about a cervical pap smear screening study of 1980 which took place in Delhi when patients with CIN2 and CIN3 were followed up to see the natural course of the disease. And of course, this all happens in government hospitals where patients don't understand and so you take them for a ride. When this was at a stage when for 50 or 60 years the natural course of the disease had been known. Everybody knew that CIN2 led to CIN3, CIN3 led to invasive squamous cancer, which eventually killed the patient. There was no justification whatsoever to do this study. It was done. The RCC trials, Regional Cancer Center trials in Bangalore in 2001, what did they do? They had these patients who came to them and they were told that you got an oral cancer and you'll be injecting an anti-neoplastic drug to see whether you're going to get cured. What they were actually doing, and this Johns Hopkins researcher was collaborating with them, they were injecting neoplastic drugs to see whether the cancer worsened. Again, They read it until they got caught. I can see that some people here are not aware of that study. No? Not aware of it, okay. Risperidone was in 2001. I think it was a little later. We published a paper in the British Journal of Psychiatry in 2005. The risperidone is an antipsychotic drug, and this chappie in Bombay did a study. He took a group of patients who were manic depressive, put them on a washout period when they had no medication whatsoever, and then he put 1/2 on risperidone, 1/2 on placebo. Both of them is wrong. When a patient is manic, he might go and commit suicide, he might murder somebody. There is no reason to put somebody on placebo. Secondly, you cannot have a washout period for such patients because that means they are on no medication whatsoever. This was published in the British Journal of Psychiatry. We wrote a letter objecting to that and said that this is absolutely poor medicine and ethics. British Journal of Psychiatry actually made a mistake and they published this letter. The HPV vaccine trial of 2010 is what happened in Andhra Pradesh when drug companies were peddling their HPV vaccine under the guise of doing a clinical trial, which the government has now stopped. Which is why there was this article which came out some years ago, can we trust the evidence in evidence-based medicine? A lot of the evidence-based medicine which is put out there is written by the pharma companies. I don't read medical journals anymore. I don't believe medical journals anymore. I've come to that stage. This is about 10 years ago I started saying this, and now I find that increasingly on WhatsApp and the like, I rarely read WhatsApp, okay? Because like I tell my son, you can either work or you can WhatsApp. I opted for work. So, but occasionally you tend to see these things. You know, somebody sends me on a personal one-to-one WhatsApp, have you read this article? And there was this article criticizing medical journals because they've been bought over by the pharma companies. And I say, yeah, I've been saying it for 10 years. But when I told you this, you wouldn't believe me. Now because the same article was on WhatsApp, you believe. No. It's the dangerous thing. WhatsApp science, it's called. I just don't believe anything they've all been done. And you must have read a few months ago, the editors of the New England Journal of Harrison's Principles and Practice of Medicine, they did not mention their conflict of interest. Each and every editor on Harrison's is a consultant to big pharma companies, and they are recommending that those pharma companies, those drugs by those pharma companies are good. May be true, but you always wonder, you know, are they being biased? Maybe subconsciously, if not consciously. Oh yeah, Richard Smith wrote this wonderful thing. In this paper on medical journals are an extension of the marketing arm of pharma companies. He says, this is how data can be manipulated, which I am realizing now. You compare your drug with a known inferior treatment, meaning you know your answer even before you do the science. And at the end of it you say, see, my drug is better than this drug. Or you use a higher dose of the competitor's drug so that the adverse effects in that arm increase. So, my drug is only as good as this drug, but side effects are less. Use multiple endpoints and choose appropriate favorable ones. So, you see that the patient is fine at 6 months, 8 months, 12 months, 2 years, perfectly fine, and at 2 months, 40% of them have a heart attack and die. So, stop it at 2 years. Patient was perfectly fine at 2 years and we recommend that to buy this. And that's the FEMSEN thing, right? Perform multi-center trials and do likewise. So do it in 20 hospitals, some of which are fudging their data. One of them does not fudge data at all and shows poor results. It doesn't fit into our data. People do it. And that is why you have to have a clinical trials registry where you put it out there and then you can't change your data later on. What's ethics? Ethics is doing what is right and following the golden rule. It doesn't use the black and white areas. These are very obvious. Am I allowed to steal? No. Am I allowed to murder? No. Should I help my, should I be a good Samaritan and help my neighbor? Yes, everybody knows it. There's the grey areas which are the difficult areas and be very careful and not cheap. There is obviously ethics and law overlaps, and all that is legal does not have to be ethical and all that is illegal is not unethical. Nevertheless, you have to be, what's that supposed to be? 5 minutes? 2 minutes. 5 minutes, she said. Other than science, I just talk about Darwin. Okay. Darwin was unethical in a way because, okay, that's not okay. Other ethical issues are suffering from impact factoritis and publishing in predatory journals. Impact factoritis, you know what that is, right? I have published the impact factor of 6.2, yours is only 6.1. It doesn't matter at all. They are supposed to publish good science. And impact factor is the factor of the journal, not of the individual. Please understand that. So if any of you guys are in the advisory capacities to Babus who make these groups for promotions, please tell them, do not look at the impact factor of the journal at all. Just see whether it's good science or not. The Royal College of Pathologists, England, I recently found, while looking at something, I discovered that if you want to apply for a fellowship, you are supposed to submit your CV to them with in brackets impact factor. So I wrote off an email to the Royal College of Pathologists saying, you guys are being stupid, you're not analyzing the scientist, you're analyzing the journal. So the guy who replied to me, and there was somebody I in the Royal College, that's why I had such guts. He replied to me saying that I was in charge of that, but I'm no longer in charge of it now. First I retired from the college, so I can't change it. But I see your point, but there's nothing I can do about it. But we need to tell people that impact factor is of no importance. Now at demands, for instance, when you go for a promotion, you're only supposed to put what your 5 best papers are and how you think it has impacted the community. Nobody looks at impact factors. That's one sensible organization. I hope others are also sensible. It's unscientific, it's archaic, and therefore it's unethical. Why is it unscientific? It's a numerator, not denominator. Nobody knows what goes into everybody knows what goes into the numerator. What is quoted? What goes into the denominator? Nobody knows. Do letters go, do editorials go, do only papers go, do case reports go, do opinion pieces go? Nobody knows. Only the ISI or Thomson writers know about it because they are the ones creating it. So if you don't know the formula, how can you go by such a thing? I'm absolutely impact factor, as you might have guessed by now. So I asked Subhaya Arunachalam, who's the information scientist from India, to write an article on this, and he wrote an article which has been published in the Indian Journal of Medical Ethics. It's free full text online. Evaluation of research in India, how we doing it right? Telling what is wrong about evaluating people by their impact factor journals. Coming to the very end, pseudo journals, which is the new term which the WHO has used for what we will call this predatory journals. Is there anybody out here who does not get 3 emails a day from global publishers, Athena publishers? Please send in your paper on astronomy, archaeology, general medicine, surgery, GST, anything. Send me publish it. In 3 days for 1,000 rupees. So, predatory journals are unscientific, they are unethical. India is home to most, you know that, right? So we are from the good city of Rajkot. Rajkot is good for producing Hardik Pandyas, but not for cutting-edge scientific journals. Indian Science is Science pages. This paper done in 2016 from the IISc showed that now it was believed until then that most guys who published it were unaware of the fact that they were predatory journals. So innocent fellows just by mistake published that, by mistake paid 1,000 rupees and so on. 80% of those authors, when asked one-to-one, said yes, we are aware of it, we are doing it for our promotion. Friends of mine who are published say, boss मेरे को मालूम लेकिन 4,500 के लिए मेरे को professorship मिलता है, क्यों नहीं करूँ? What do I say? So, okay, this was in science, of course. It was not just medicine or science, but 25% of them were doctors. 6% of them were ICMR researchers, guys who know the rules, guys who write the rules and are willing to fill. And yeah, the Medical Council of India shenanigans. I can talk for an hour on that. I don't know the name. But a study last year in Nature by David Cohen and group showed that they looked at 2,000 papers from 200 journals in inverted commas. India was the world leader as expected. The US was next. And in the US there were papers from the NIH, which is like their ICMR. There were papers from Harvard. Okay, I'll tell you guys something that you like to know. They contacted the authors of all these papers or the VCs of these universities. Most of them did not reply. One place which did reply was Manipal. Manipal University replied and said that we found that our guys had published in predatory journals and we have taken active steps. We've educated them about it, we've told them it's not on, and it has drastically gone down. So that's good news. That means somebody is aware of it and is educating its students. One other very, very prominent medical college which I will not name, no reply at all from them. And people are continuing publishing them. So what this study said was, over those few hundred journals and 2,000 papers they had seen, there were 8,000 animals and 2 million people who had been researched and whose junk data was being put out there. And they estimate that there are 8,000 predatory journals out there which publish over 4,000 junk articles every year. It's a waste of time, waste of resources, and it's poor science. This is the first editorial that we wrote in 2015 against the MCI, and they came out with this stupid thing on promotions, and only the first and the second author get promotions. E-journals will not be accepted, they said, and they said only original papers get promotions. No case reports, editorials, etc., etc. So we criticized it in many ways, and the MCI actually sent us a mail saying, we see your point, we'll change it. So they changed it and made us the stupid blunder. Which should have surprised us in retrospect. So we call this MCI's amended qualifications for Indian medical teachers, well intended yet half-hearted. Actually, we had we criticized them even more in the time when somebody said, that for Brutus is an honorable man style, you should at least थोड़ा तो praise करो यार, फिर तो पढ़ेंगे. Praise उतना भी praise नहीं करो, कोई पढ़ने नहीं वाला. So 6 of us have published that in the IJM and 5 or 6 other journals. So how to avoid the trap? Select the collaborators very carefully. If in doubt, withdraw from the study. If you think that the guy you're collaborating with is a fraud, and this has happened to me once, and despite us collaborating with a proper fraud, I ended the study then and there. You have IRBs to take care of this. Solutions. Deans must investigate misconduct. This is a good thing. Like I said, the KMC has actively taken steps to improve. Appropriate punishment must be given to those who indulge in fraud. We get away with it in India right now. Until that changes, it's going to continue this culture. You must have undergraduate and postgraduate education in ethics. Okay, I come to the end now. The Code of Ethics given by the World Economic Forum Young Scientist Community in 2016. I urge you to go to the web and read it. It's a 8-page document which is worth every line of it. And gives you these 7 rules. Engage with the public. This is what you said. Engage with the public. Tell them what you're doing. Pursue the truth, because that's what science is all about. Minimize harm. That's do not publish in civil journals. Minimize harm. Engage the decision makers. And I mentioned this in my talk yesterday. When you have a chance, you have to get out to committees and engage and make a difference. Support diversity. This took me by surprise until I realized that if everybody thinks the same way, there is going to be no discussion, there is going to be no change. You must have diverse people with different thoughts. You might even want to have a right winger in your company. So you've got to have different thought processes to promote science. You must be a mentor. Unless you are a mentor, you are not completing the cycle because you are taught by someone. You have to teach someone so that someone can again teach somebody else, and that is what science is all about. Be accountable in every way, whether it's financial or not financial. If you made an error, retract the paper. That's accountability. In a nutshell, if you listen to our parents and grandparents, honesty is the best policy, is what we were taught as kids. The moment you stop listening to that, you land up in this research misconduct business. Okay, that's